Thank you. And as you saw, the session is being recorded and the slides will be uploaded in Canvas following this session. My name is Ellen Zakowski, and I am an assistant director at the Polsky Center for Entrepreneurship and Innovation at the University of Chicago. And before we kick off today, just wanted to say a huge thank you to the FAST Center at the University of Illinois at Urbana-Champaign for making it possible for us to host this sprint for all of you. We were so impressed with your applications and are really looking forward to getting to know you over the next few weeks. And also want to share deep appreciation for our partners at Northwestern, and especially their innovation and new ventures team for being fantastic collaborators in this effort. And on that note, I'm going to pass it over to my colleague, Sonia Kim from Northwestern to get us started.
Sure, thanks, Ellen. I wanted to echo your sentiments regarding the introduction. I just wanted to say a quick hello. My name is Sonia Kim, and I'm calling from Northwestern's Innovation New Ventures Office. And I believe there are a couple of my colleagues here on the call as well, Lisa Dar and Alexander DePaz. And we're just really grateful again for the FAST Center and really helping to promote entrepreneurship at the Illinois state level, as well as for the University of Chicago for just this opportunity to partner for this wonderful sprint workshop. And we're just looking forward to this month and future events that we can collaborate together on. So with that, I'll pass it over to Roland, who is our lead instructor.
Well, welcome to everybody and glad to have you along with the sprint. Let me echo Ellen and Sonia's comments. The impressiveness of the groups was really notable. It was some tough decisions to decide who could be selected and who couldn't. Unfortunately, we don't have the resources to accommodate everybody, but for those who weren't allowed into the session just because of resources, there are going to be some auditors to the course. So if you are an auditor, feel free to read the discussions in the Canvas. Feel free to chime in during the discussions and ask any questions during the sessions. And we're glad to have you involved. We wish we could give everybody the same amount of attention as we could to the 8 people who were selected. Some general administrative things just before we get going is this is an informal workshop format. Kris and I will be the main presenters. We will have other presenters later on, but we encourage a lot of interaction. I learn a lot from everybody, and we hope that you can learn a lot from each other. So please do chime in. We will be monitoring the chat, so you can ask questions in the chat. During the presentations, I'll pause for questions, but as you have questions, feel free to put them in the chat. If there's a question that's easier to ask or verbally, just raise your hand and then we'll call on you. You can unmute and raise your questions verbally then. But yeah, feel free to share, ask your questions. We want to learn from everybody else. Also, I'll mention, Kris and I are available for one-on-one consultations outside of the presentations, and we encourage you to take advantage of that. Our office hours are posted in Canvas. There's a page that says about instructors and study groups, and our contact information is there. You can send us emails for quick questions. You can schedule a one-on-one conference with us. We encourage you to take advantage of that. The information is in Canvas. Also, I'll mention a word about the assignments. Each session will have a bunch of assignments, and you're already familiar with that because we've given you some assignments ahead of time. These assignments are not graded, and these assignments are primarily tools for you to use. They're not ways for us to assess your progress as educators and instructors. They're mostly tools for you to use. So Kris and I will look them over, we'll give comments, we'll give some suggestions, but this is not a grading type situation. So use the assignments as you deem best, as you see fit. If you want to add to them or change them a little bit, that's fine. It's a tool for you to use. We'll comment as we can, but use the assignments freely and broadly, and hopefully take advantage of our comments. Also, the assignments themselves are subject to criticism. So if you have any suggestions on how to make them better, we welcome that because we're always looking to make the course better. Kris, anything else to add initially?
No, sir.
All right. So this week, here are the topics we have in mind. Case statements. We're going to review the case statements and the readiness checklist that you all provided, and you provided some very insightful comments. You're very well along. This group is a lot further along than a lot of SBIR groups that we work with, and that's encouraging. We will talk about the structure and flow at a high level of the proposal without getting into the details. I'll talk a little bit about development timeline because you need to plan ahead to make sure that everything gets accomplished on time. And then Kris is going to talk about registrations and topic selection. All right, so let's talk a little bit about the case statements. They were impressive. You folks are very well along. You've got mature technologies. A lot of you have got a lot of things in place already, and that's nice. Here's my assignment review. I'm reviewing the assignment itself. I think the order of presentation could be improved. In the case statement, I had a list of topics, and I'm going to adjust them a little bit. You'll see in these slides the assignment order or the case statement order is improved. Let me talk about a few sections, some trends that I noticed throughout the assignments just to keep in mind. When you're talking about the needs section, it's very critical that you establish the importance of the problem first and then discuss your solution. And here's a very good example. The doc company had a statement like this: cardiovascular disease is one of the leading causes of death in the United States. Well, bang, that's a nice big problem. That's a good overall problem. Everybody can see that. Then you proceed, okay, this is the problem. Here's how we're going to address it. Here's how we're going to prove that we can do what we're going to do. So you have to start out with that problem. Not so good was dolor. I mean, your very first need in your needs section, you started talking about the product itself. What you need to do is first establish the big problem that your project is solving, then proceed to the next case statement. All right, technical goals. Here I saw, and this is very typical. Here you need to switch a little bit from the academic mindset to the business mindset and the feasibility demonstration mindset. You know, in academia, if something hasn't been done yet, it's worth doing, especially with NIH. Any kind of research goal, if it hasn't been done, let's do it. But that's not really sufficient for the SBIR program. You need to have goals that are feasibility goals. The whole idea of a phase 1 proposal is to show that your technology basically will work, to identify the areas that you're most concerned about and make sure that those key areas work. Now, Clairvoya had a very nice one. Here's a key statement here. We need to reach 0.1 seconds on native resolution images 1028 by 1028. Very clear, very easy to measure, precise. You know, if you can do this, you know you're good. If you can't do this, then maybe you shouldn't proceed to phase 2. We will talk more about specific aims in session 3, so you'll get more instruction on this, but I noticed this in the tech goals. Think in terms of feasibility, in terms of what you can really prove. All right, in terms of customers, a lot of people are thinking that, if you make a product available, customers will buy it. And that's not necessarily true. Just because you have it doesn't mean the customer will buy it. Also, the person who will buy it is not necessarily the person who will make the decision to buy it. And here's where I'm going to adjust the assignment in the future. I didn't talk enough in the assignment about the influencers and decision makers and their role in the process. I just asked about buyers. You need to think about buyers, but you also need to think about advisors and decision makers. A lot of patients are buyers, but they'll do whatever the doctor tells them. And so you really have to appeal to the doctor. If you're making equipment, the doctor makes the decision of what he wants, but it's the clinic who buys it. So you need to understand those roles. Exomira, this is an area to work on. You said that your customer was populations with potential risk of novel viruses. You need to tighten that up a little bit so that you say clearly who's actually going to do the buying. A population is a vague term, isn't going to buy. Who's actually going to make the purchases and who will make the decision to purchase. All right, and this is a common concept that I see a lot of times. You tend to say there's no competitors in our market. And there probably isn't anybody that's doing exactly what you're doing exactly the same way, but you always have a competitor. So when you get to the proposal stage, you'll want to never say there are no competitors. If nothing else, the way things are happening now is a competitor. The way things are the way people are doing things now is a competitor. Any reason to not buy is going to be a competitor. All right, that's the end of the case statements. Kris, you had some other things to say about case statements.
Yeah, you
Trends
touched
you
on.
noticed, and then we'll go ahead to the readiness checklist.
Yeah, you touched on some of them. Just the confusion between all the different roles that are involved in the when you say who's the buyer. There's decision makers, there's payors, there's purchasers, there's end users, and sort of understanding what motivates each one of those groups is really important. The other thing, when we talked about demonstrating the need, typically when we talk about need, the way I phrase that for people is, why should anybody care? What is it costing? And primarily when we say, what is it costing? It's not just money, but what's it costing in terms of lives, in missed work days, in missed productivity, in opportunity costs. Why should anybody care about your problem? That's really what the need needs to focus on. And then finally, as you just mentioned about competition, I totally agree with what you said. And I think it's really important that you always recognize it's really, really hard to change people's behavior. So because it's better for them isn't enough. We were one time working with a company that had a new way to remind people to put on sunscreen. But if we don't even want to put on sunscreen, period, what difference is it going to make if you remind us to or not? So it's really hard to change behavior. And so understanding the competition is really important.
All right, then, Kris, you're going to go ahead and talk about the readiness. You reviewed the readiness checklist. So trends there.
Yeah. Roland prepared that form, and I really like it. I've never used anything like that before with the clients that I work with, but I think it was really helpful to just kind of get a global overview of where everybody was. And you're not alone if your team feels like you're struggling with sort of the business side of the house. That's a common issue, but usually something we can overcome just by talking about what individual roles are. And so I put a comment on that of several readiness checklists that as we work through this and figure out what buckets people actually go in, sometimes that becomes clearer. I think it's really important that everybody starts thinking about their requirements for a regulatory pathway. That's a favorite thing of reviewers to call out, is that you don't know anything about the FDA pathway that's going to be required and what the pain points are involved. So start thinking about that now. It will need to be included in your proposal. And also your registration. Some of you had checked that your registrations are done. We will be double checking those. They do expire. And they require password resets, and there's nothing worse than being at the deadline trying to reset a password. So we'll check on that, and we'll also talk about ways to keep your passwords organized.
All right, so I will comment now. Any questions or comments on the assignment or the information so far? We'll pause just a moment and see if anybody raises a hand or poses a chat. All right, then proceeding on with the positioning strategy. Here is a big overall goal that you're going to hear throughout the course of the sprint. Proposal preparation is more about positioning than it is about presentation. It's more important that your company have the right factors in place and first, and then you think about how you write it and how you present it. We're going to give you some tips on presentation for sure. But more than anything, you have to be in the right place. That's why you got a readiness checklist. That's why you got a case statement. Even before we talked about how you address that in the proposal format. You'll get some presentation tips, but you have a lot of research to do. You have a lot of customer discovery to do. You have to make sure your tech is in the right place. There are partners you need to build. You need to think through how you're going to organize the research plan. What you propose technically has to have every bit as much rigor as a research study that you do as a graduate student or for your research work. So it's got to be seriously well-designed, rigorous research with evaluation components that can be, that could meet like a peer review status, peer review regulations. So there's a lot of research and legwork to do to get you in the right place. Then when you're in the right place, then you write it. So you'll hear that a lot. We'll talk more about positioning and the legwork you need to do than we do about the presentation. But going ahead to the presentation, at the highest level, it's important that you have a good logical flow to begin with. And you need to appeal to two audiences. When people review your proposals, the reviewers are made up of some people who are primarily commercial people who understand the marketplace, and they will look at how well your commercialization situation is. And you'll have technical reviewers. Now with NIH, the technical reviewers are a little more heavy weighted than the commercial reviewers, but you still need to have both of those audiences in mind. You need a top-down approach in your presentation. A typical nicely wrought academic document will lay out all the facts, and then at the end come to the undeniable summary that you've led people along, and you get the grand conclusion at the end. And when you write a proposal, the presentation has to be the opposite. The main conclusion needs to be first. Here is what we're going to do. And then you support that with points along the way. So it's kind of an upside down approach. It's a top down approach. Big points first, then little points later on to support the big points. And that's why I had you do the case statement. The case statement is your main points, the main arguments that you're going to support throughout the course of the proposal writing. The case statement also is to help you identify where your weak areas are in positioning. So if there are some cases where you really can't prove a point too well, where you make a statement that needs support, you know you have a little bit of research to do to get to that support. All right, so let's look at the overall flow. Now you're familiar with this because it's the case statement. I'm going to talk through the logic here, but this is a little bit different. This order has been improved since I gave the assignment, because I think this order is a little bit better. You start out with a big need. What huge problem are solving? You've got to establish that there is a need first. You know, if people are dying because of something, you say people are dying and you give some numbers. Here are the number of deaths per year. Really support that station. This is a problem to solve. Then, well, our technology can meet that problem. We're going to be able to address this problem. We will solve it. We will reduce deaths. We will do X, Y, and Z. Here's how we're going to meet the problem. Here are the great things we're going to do. And then you say, and no one else is really doing it in exactly the same way. There are some other people that are working in this field, but here's where they fall short. There are some other people working in this field, and we're going to build on that. So you present yourself as a player in the field by talking about what's the latest and greatest. And people will buy this. This is an important point. Kris mentioned it earlier. You have to have real buyers with real money wanting to pay for the real solution. So those people are going to buy it, and they're going to buy it because it's new and different. We're doing something that has not been done before. Here are the technical risk factors that make our technology a cut ahead of everything else that's been done already. And here's how we're going to do the research plan. Here is how step by step we are going to make sure that the technology works. And here's how we're going to prove that the technology works. And here's why we're qualified to do it. So this is the high level arguments that you make, the flags that fly atop the tents. And then all your work in the proposal preparation and in the proposal presentation is to support these main points. So when you have the case statement, you want to refer to it often and make sure that when you're writing something, it supports one of these points. Then once you've got the main logic in place, then you figure out, all right, how does this actually flow into the proposal? Now with NIH, here are the major text sections. You've got a specific aims section. You've got 3 sections in the research strategy, and then you've got some bio sketches. You also have an abstract summary, which is not on this slide because the abstract summary is sort of a miniature version, a condensed summary of all of these other points. So you can think about what goes in these other points, and then you can later on put that in the abstract. All right, so as you think through your main case, and these dots here represent the points, the way that you're going to substantiate the main case. So for need, demand, and impact, let's say you've got 3 main ways that you're going to prepare that and substantiate that. You say, okay, well, where do these actually flow into the proposal format? All right, we've got 3 statements here. Maybe one of them goes in the specific aims and the other 2 points is more appropriate for the significance. So we're going to place those 3 points where they belong, 1 in the specific aims and 2 in the significance. Do the same kind of thing with tech. Okay, maybe one of them goes with innovation. Maybe one of these points is more towards the approach. So we're going to move these sections here. And for each section, you look at your main points, you figure out where that flows into the proposal, and you put the points there. This is all at a high level. Bullet lists are fine, just little sentence fragments is fine. And you determine where in the proposal each of these main points is going to go. Then you look this over and you say, oh, this is still kind of confusing. It's not really straightforward. We need to adjust this. And you adjust the points, you jostle this, you work with it at a high flexible level. And you do all of that before you actually start fleshing out each section. If you start too early with the first section, say, okay, well, I'm going to start with approach. So let's start with the approach. Let's start with the specific aims, figure out exactly what we're going to do. You start with that section, and then if you do it section by section, you tend to be a little disjointed, and then you have to go back and rework sections a lot. But if you come with a high level approach like this, then each time you're writing a section, you'll know how it fits into the bigger picture because you have established the bigger picture. All right. As a resource uploaded in Canvas is a status by section spreadsheet that lists all the sections of the proposal. There's no assignment associated with this, but it's a tool for you to use. When you think about who's going to do each section and what goes into each section, and when you want to make sure that you've got all the sections covered, you can pull up that spreadsheet and use that as a double check to make sure you've got all the sections covered. All right. Any questions on this overall flow before I start talking a little bit about overall timeline? All right, timeline. You invest a lot of time in a proposal. Companies who have done them before, who have mature people who are very fast writers and PhD level staff, take about 3 person months time on task for the whole team to write a competitive proposal. Some say it's in 2, some say it's 4, but averages around 3 person months. That's a lot of time. That's a serious investment of your time. And that's an investment that needs to be managed every bit as well as any other project that you plan to spend 3 months of person time on. That means you need to think through all the steps, think through how you're going to do it. A lot of times I think, people will just tend to try and work the proposal in, kind of squeeze it in where they can around the rest of their work. And then that's what happens. It gets squeezed in around and it's not effective and it's not planned. And when you don't plan for it carefully, you risk 3 person months worth of work. And you don't want to place that at risk. That's not a good use of resources. So one of the tasks in managing is to think through the timeline ahead of time. And you need to start where you're starting now. We're in a good place for the September 6th deadline, a good 3 months ahead of time. So these are weeks ahead of time, 10 plus or 10 more weeks ahead of time. And here are the things you need to do. These are the things that we're going to be assigning you. Reviewing the program guides, reviewing all the applicable guidance, thinking through the summary and the case statement, and contacting the program office, which Kris will talk about a little later in this section. So start getting all of this high level work in place a good several weeks ahead of time. At least 2 months ahead of time, you should be identifying your partners and requesting letters of support, or at least letting them know that you're going to be requesting letters of support. And actually, I should put this in the same block because you should be doing it right now. Registrations, they can take a month when everything goes well. And things don't always go well. So you want to keep after the registrations, make sure that everything is in place so there are no snafus while you're trying to submit at the end of the process. Get them done ahead of time. Then, a good month ahead of time, you should have an initial draft of your proposal, pretty much the whole document in place. There'll be some holes. There'll be some points where you still have to fill, but pretty much an initial draft that you can start sharing and start having other people look at a good month ahead of time. A couple weeks ahead of time, you should have a complete draft. And the complete draft you can show to a red team or a tiger team. You can have independent reviewers looking at it, someone who hasn't seen the proposal as well. And you have time to deal with the substantive comments. If they say, yeah, there's a whole section, there's a gap you haven't noticed, you've got a couple weeks you can fill in a big hole if it appears at that time, if you become aware of it at that time. And then in your timeline, you should plan on submitting a good week ahead of time. Now, if it's 2 or 3 days ahead of time, that's still pretty good. But a lot of times the submission process gets screwed up. You don't have the right access set. Your computer goes down. Things screw up that have never screwed up before. You want to give yourself a lot of time to recover from that. And you want to do it in a way that doesn't induce further errors by increasing the likelihood of error. So you want to have plenty of time to, in a relaxed way, accommodate and adjust for any changes. Then a week ahead of time, you can spend the last week helping your partners and your colleagues who haven't done the planning and who are rushing around and need some help. You can help them out in a good amount of ahead of time. All right, and so then after submitting, you wait, and you wait, and you wait, and you wait a good 3 to 4 months. And if you're selected, then you'll get an administrative review. You won't get a notification you are funded. You'll get a review. You'll get a notice, an email that says you've been selected. And here are some other questions that we have. And here's some more information that you need to supply. And you have to supply another round of information. And you might have to respond to some questions that they have. Then, maybe another month goes by. You get your final awards and rejections. And you get a debrief. You always get a debrief. Make sure that you get the review committee response, because if you get rejected, you can submit again. A lot of times, success with an SBIR project is a 2-submission process. You submit once, you get reviewers' comments, you get a little bit of better idea of what they're looking for, you address those comments, you reapply, and a lot of times you get it on the 2nd submission. So I will also point out that even if you get rejected the 2nd time, the work that you've put in on the proposal is not wasted work, because it helps you clarify what you're trying to do. It helps you pull together your goals, your ideas. Just the exercise of writing the proposal is a good exercise and will help you as a company, will help your projects, will help your efforts. All right, let me pause for a moment here and see if there are any questions about the timeline before Kris talks about registrations. We could say a lot more about every one of these items, and I just kind of covered the high points. But Kris, if you have anything to add, please chime in, and then we'll see if there are any questions.
I just have one thing on the timeline for after you submit the proposal. You will get that debrief. Everybody gets summary statements, whether you're funded or not with NIH. You receive a minimum of 3 summary statements or 3 reviewer comments. And you typically have those, well, you do have those within 3 weeks of the time that your study section meets. So you do have those relatively quickly after your study section meets. And then you move on to that award/rejection process.
Oh, I should also say there's another resource available to you that's in Canvas now. It's another spreadsheet, and it's an example of a timeline. And we don't have an assignment with this timeline at this session, but at the end of session 3, we will. We will ask you for a draft timeline just to make sure that you're looking at all of these points and to see where you are and make any suggestions and things you might have overlooked as you do your project planning. So the example timeline is available now. Download it, use it, change it around, make it suit your purposes. We'll ask for it again in session 3.
There are a few questions in the chat, Roland. I don't know if you're able to see those.
All right. I'm not seeing questions in the chat.
Okay.
Now they're showing up. Okay.
Okay.
Thank you. For some reason, my chat wasn't refreshing. All right, back to the case statement. The number of dots don't represent any particular number of items. That's just an example of what you might have in terms of points. You will have more or less points. Just an example. Sweet spot for risk, excellent question. And we will talk specifically about that in a later session. Shelley is going to talk about that in session 3. But to give you a very quick response right here, what you want is a technology readiness level where you're past the lab, where you've got something of a working prototype, but there are still a lot of unknowns. If it's too far along and if it's proven and you're 99% sure that the technology works, it probably isn't risky enough for the NIH. It isn't risky enough for SBIR. They're looking for risk. They're looking for innovation. They're looking for something that needs to be de-risked. That's the purpose of the program. If there's no risk, there's no reason for them to fund it. Will the slides be available? Yes, absolutely. The PDF will be uploaded as soon as the session is over. Oh yeah, the details, the resources are under files. And if you look in the modules section, you'll also see the resources listed in the modules section, either one of those two places.
I just want to add something about that risk thing. That is a really interesting question, and it's a very, very slippery slope. It depends on the agency primarily, and today this whole sprint is focused on NIH. So from the NIH perspective, I would say they're a more risk-averse agency. And while there needs to be risk that there's potential for failure, they have a higher threshold of required preliminary data. And even though the guidelines say that preliminary data isn't required, I would say that preliminary data is required. And that preliminary data needs to be enough to give reviewers reason to believe that you will be successful. There certainly are failures, but for NIH, that threshold is just a little bit higher than other agencies, like take NSF, which just loves wild and crazy ideas and embraces risks. So that's my 2 cents.
DOD tends to be more risk averse as well. So yeah, you do have to know the agency, and level of risk is a good question to ask when you talk to the program manager. Once you get the program manager on the phone, you can say, are we at a good level? Do you think this is the right level? That's a good area to ask about, because they will talk a little bit about that. And Kris will talk about contacting them later on. Is there a possibility of redacted successful applications? An entire application redacted is kind of hard to come by, but I've got a list of some links, and I will upload those links that show some redacted proposals, some that NIH has made available. Kris, what do you say about proposals, making some available?
I say I never encourage people to rely on other people's proposals or even sample proposals on the internet. So.
Well, yeah, that's a good point. And now one thing that most of the agencies don't like boilerplate. If they perceive that you're just checking the boxes and filling out the form, they're not going to be too happy about that. Everybody's story is unique. Everybody's technology is unique. Everybody's approach is unique. And so you need to respond to the proposal in a way that best suits your unique technology, your unique company, your unique situation, your unique marketplace. So I do have some, but when you look at them, do keep, look at them with a grain of salt in mind. And you say, well, here's how this person did it, but yours might be quite different.
And, things are always evolving in this program. As reviewers merge or, roll in or out of a panel, things change, and we see trends and reviewer comments and key points that reviewers pick up on. And if somebody submitted an application 3 years ago, I can pretty much guarantee you that reviewers won't be on the same hot buttons today that they were 3 years ago.
Yeah, another good point. All right, last question for now. How do we contact the program office? Oh, what a great question, because that is one of the topics that Kris is going to talk about. So I'm going to stop sharing my screen so that Kris can share her screen and go ahead and take over. And you'll get that question answered.
Okay, now you know me in technology, so wait, give me just. This team wanted to use things like Slack and all kinds of tools to communicate. I don't know how to use any of those things, so I apologize. I'm such a Luddite here. Okay. All right, so I'm going to first talk about required registrations. And you can see the list of the registrations are over to the right side of this slide. And you answered questions about all of those registrations on your readiness checklist. So we're talking about the EIN, or the employee identification number, which is the same as a tax ID number. Some people might be used to that acronym instead. Your DUNS number, SAM registration, grants.gov, ERA Commons, and SBIR.gov. So a couple of things to keep in mind. First of all, they have to be they have to be registered. You have to register for them in the order presented. And that's why I kind of have those arrows, because one builds off the other. Now, there are some exceptions, like you can do your ERA Commons while you're waiting on your SAM, or you can do the SBIR at any time, but this is the easiest order to do them in. Really, really important, these registrations are always free. You will never, ever be charged from the government to acquire a DUNS number or to register for SAM. There's lots and lots of scams out there that will make you think you need to pay, but you don't. And those are always free and always available for to the public. I recommend that you use the home address of the founder, of one of the founders, as your primary address. And there's a couple of reasons for this. First, you cannot use a university address. So you cannot claim university property as belonging to the company. And second, if you use an incubator space, it creates all kinds of problems clearing SAM. And we'll talk about why later in a slide when we talk about SAM. And third, because those spaces frequently change, and using somebody's home address, odds are they'll be in that place longer than the company will be anywhere else. And you'll be more likely to not miss important notification via mail from, for example, the IRS. So that's what I recommend. If you've already registered and you didn't use a home address, not that big a deal. If you've already registered and you used a university address, you will need to change that. Also, if you have questions on any of these registrations, I highly recommend you call right away. I have always been pleasantly surprised with how helpful the folks are on the other end of the phone here. And they give you a case number and you can follow it all through the process, but don't wait till the last minute to do that because they need time to work on things. Similar to what I just said about things are always free, you'll get lots and lots of junk emails. You ignore any email that does not come from an email address that ends .gov. So they will even appear to be from the government. They will have the government in their name, but if it doesn't have that extension .gov, then it's a scam. And they will never call you on the telephone. I've had clients receive phone calls before from people who claim to be from DUNS saying that they need to pay $600 right now, or their credit will be ruined forever. The government does not call you and say that. Okay, before you can begin your registrations, the company has to actually be formed. Back in the day, when we did paper submissions by mail, the company did not have to be formed before we submit, but now because everything's electronic, you have to form the company. And those steps include filing articles of incorporation with your Secretary of State's office. You must have a business bank account opened before you begin your registrations. And I recommend you create a table to keep track of username and passwords as you go. One thing that you might want to do before you start is sort of determine those roles internally. And this is a little table that has some of the roles you're going to see in registrations. First, the principal investigator, that person is typically the technical lead on the project. Then the signing official, and that individual represents the company, and they have the authority to enter contracts on behalf of the company. So they are authorized to sign. Similarly, an authorized organization representative has the authority to submit proposals on behalf of the company. And then an authorized administrator has the authorization to make administrative changes or submissions based on behalf of the company.
Hey, Kris, a question on home addresses. The question is,
Yeah.
if home address is used, is there a risk of a lawsuit or legal matters that may compromise the home of the founder?
I don't know that. That sounds like a legal question that I'm not qualified to answer, above my pay grade, but it's simply an address. It's like using a PO box. So I'm not sure. I mean, you could even use a PO box, I suppose, but I don't know the answer to that question. Your EIN, you can get online at the IRS's website. It's immediately issued. Here's the link for that. DUNS, make sure you use this link that's included here to request your DUNS number. This is the federal government entry side instead of the public portal. To get your DUNS, you have to have an EIN number. So that's why, again, I talked about you have to go in this order. And it usually takes about 24 to 48 hours to get your DUNS. Once you get your DUNS number, And that's all electronically. You just request it online. They send you an email. It can take another 24 to 48 hours until SAM recognizes your DUNS number. So you could be talking about 4 days total for that DUNS number. And then SAM is the one that we really worry about. This is the one that's really hard to get around. It can take up to 3 weeks to complete. There is absolutely no way to force yourself to the top of the list. I one time had a very angry client who was a well-known prestigious professor at Purdue University and thought that he could wag his weight with SAM and get himself moved to the top of the list. It just does not work like that. They're taken in the order that they are received, and they do not bend on that. You're going to enter your address exactly like you did for your DUNS. And when I say exactly, I mean, if you spelled out street with DUNS, you spell out street with SAM. If you had your apartment number on the first line with DUNS, you're going to do it with SAM. If you had it on a second line with DUNS, you're going to do it on a second line with SAM. It has to be exact or it will not go through. When you're doing your SAM, there's the opportunity for you to choose whether you want to receive, apply for federal grants or grants and contracts. Select grants only. Contracts opens up a whole other level of required registrations that have to do with the FAR, which are the federal accounting regulations. You may eventually want to compete for contracts, and that's okay. If you decide that you want to submit an application for a contract solicitation, like for the Department of Defense, at a later time, you can go back and update your SAM. But right now, you're just doing grants, and just stick with the grants to at least get your SAM approved. There's also a question when you're registering for SAM if you'd like to make your information available for public view. You need to select yes, and I know that might sound scary, but people are not going into SAM looking at your information. Rather, it means when you call the help desk, they can see it. If you don't select that, you cannot get help from the help desk, so that's critical. And SAM requires a 3-step approval process. The first you'll get an email saying, hey, congratulations, you submitted your SAM. Then the next thing that happens is they match the information that you entered with that EIN number or that tax ID number, and you get a verification of that. Then they match your DUNS information, get a verification of that. And then the tricky one is the DLA assignment of your CAGE code. DLA is the Defense Logistics Agency, and they are responsible for issuing CAGE codes to anybody that does business with the federal government. And the CAGE code is like some sort of geographic classification. And this is where the address becomes a really big problem if you're in a shared workspace, because what CAGE is interested in is access to information. And so they may require proof of, for example, a copy of a lease. If you're in a shared, for example, we had issues with somebody that was working out of Matter where you don't have designated space. This can be really create a really big challenge to get past with SAM. So that's why I typically say, if possible, use the home address. Again, if you get stuck, there's the help number for the Federal Service Desk. SAM is one that you're going to want to start early. Do it right now, even if you're not sure you want to apply, but you can at least just have it done. Once your SAM is approved, and again, that can take up to 3 weeks or longer, I suppose, if there's issues. Oh, and I should say, frequently, once the SAM gets to DLA will send you an email and ask you a series of questions. And you have 3 business days to respond to that email. And if you don't, it kicks you out and you have to start all over. So once you submit your SAM, keep an eye on your email for follow-up emails asking for additional information. Once your SAM has cleared, again, you have to wait about another 24 to 48 hours for grants.gov to pick up your SAM registration. You have to have a current and active SAM registration to do grants.gov. Now, you register for an individual account, which you don't have to have SAM done to do that, you could go in right now and create your individual account. But then in order to be able to submit an application, you must link your individual account to the company. And you do that by using the DUNS number. And they take that DUNS number and they go to SAM. So that's how those two are connected. Grants.gov uses your DUNS number, goes back to SAM, finds out who your eBiz point of contact is, which is the person who was named in SAM. Grants.gov sends them an email that says, hey, Roland, you're the eBiz POC for company ABC, and Sue just tried to register as an authorized representative of your company. Then Roland logs in to grants.gov using his eBiz POC credentials, which they will send you, and he authorizes that person to become an AOR. Now, a lot of times, all these people that we're talking about, the AOR, the PI, the SO, it's the same person, okay? The majority of the time, startups have one or two people in them, and the same person may be all these different roles, but you still have to have separate accounts for all of it. So there still has to be a company account and an individual account, and the individual has to link themselves to the company, even if they're giving permission for themselves to become a representative. Registrations are one of those things that's kind of hard to talk about in a presentation. It's easier to do, like, you know, if you're actually going through it, but it's kind of hard to talk about just theoretically. Okay, and then once your grants.gov clears, and again, ERA Commons you can do once your SAM clears. You don't have to wait for ERA Commons, or for grants.gov, I'm sorry. ERA Commons is NIH's own portal, and you will use ERA Commons to communicate with NIH from inquiry and submission all the way through closeout. So this is their primary portal that you'll use for everything. So you'll become very familiar with ERA Commons. The first thing that you do on ERA Commons is you create an SO, or signing official account, for the company, okay? So that belongs to the entity, not to the person. Once you create that, then you're able to link PIs. A lot of you who are faculty in institutions may already have a PI account with ERA Commons. The PI account in ERA Commons follows the person your entire career. That is your account. You never lose that. So what we do is we link the PI to the company. The company is the one that creates the new account. Something new that NIH just instituted is that now all key persons on NIH proposals will have to have a Commons account, not just the principal investigator. It's very easy. Once you create that SO or that agency account, it's very easy to add other personnel to your account. It's just a matter of clicking a button inside ERA Commons. So that's not going to be a big hurdle at all, but it is something to be aware of. And then there's the telephone number for the ERA Commons help desk. And the easiest one of all is sbir.gov. This is SBA's registration platform. It simply confirms that you're a small business that meets the requirements to compete in the program. Once you're registered, and this is instant, by the way, so you'll go in and register and they'll email you back your credentials. Once you register, you have a lovely little, it's pretty user-friendly, like dashboard, and you're gonna just kind of print or PDF a copy of your certificate in there. And you need that certificate number. You're issued an SBC number, which is a small business control number, and you will need that number for your application. So you want to keep that handy and include that number on your sheet that you're using to track all of your registrations. Okay, I think that's it on registrations. Roland, any other questions about that?
No, it's just, well, the one point to make is that the AOR in grants.gov should be the same as the SO in ERA Commons.
Yeah, you have to enter your AOR username and password when you submit a grant in ERA Commons. So that's correct. That's the person who's doing the official submission of the application. That's the individual who has authority to submit on behalf of the company.
Yeah, so in ERA Commons, you'll have someone designated as the SO role, and you should have that same individual designated in grants.gov as the AOR.
And you
Otherwise-
can change those as time goes along.
Yeah.
So, I generally make the SO account a very generic company name, like Newco SO is the SO account name. And that because you can add and remove people, giving them authority to be an SO. And same thing with AOR. That's what you're doing. What the e-business point of contact is doing is going in and giving that AOR authorization to submit. If that person leaves the company, you simply remove their connection to the company and they no longer have access.
All right, some questions are coming in the chat. Excellent, excellent. Is sbir.gov registration needed for STTR registrations?
Yes, because even on an STTR, the primary applicant is always the company. And in order to participate in the program and submit an application, you must have an SBC number.
All right, if we apply for STTR, do we need any other registrations?
No, you do not need any additional registrations, but you need all of these. Because again, even STTR, the company is the primary applicant. The company is always the primary applicant, even on an STTR.
I will add to that though, since you have a sub-awardee budget, your the sub-awardee organization, like the research institution, will probably need to have an ERA Commons registration. They always do anyway.
Yeah, you don't need, you just need the PI's ERA Commons name, but you don't need their ERA information. You'll need their DUNS number, but they typically provide that on the budget.
All right, next question. After we do this, will we be provided a contact for the program office?
No, that's separate. These are just required registrations. We're going to talk about contacting the program officer now. Is that what the question's referring to? Don't know. Maybe they can ask again for clarification.
Yeah, let's see. If we apply for STTR, do we need still to use home address for registrations?
Same thing. The company is the applicant. We're talking about your company address.
All right, is the following correct? To create an ERA Commons registration, we need a SAM registration, but not necessarily grants.gov at the point.
Yes.
Okay.
That's correct.
All right, that's all I had for registrations, and that's all that showed up in the chat. Let's go ahead. We've only got a few minutes left, and we want to leave some time for any other questions.
Okay. All right, topic selection. Let me be very, very clear about this. You do not need to identify a specific topic to apply to NIH, okay? NIH is interested in seeing anything you have relevant to public health. Now, it behooves you to find a topic that fits so that you can make contact with a program officer. But generally speaking, if it involves public health, they have over 240 pages of topics. If you cannot find a topic relevant to your technology, then it might not be benefiting public health, but it is not required. If you're applying to Department of Defense, you must have a very specific topic that you're applying to. That is not the case for NIH. I have many NIH proposals that go in where they never even talk to the program officer. Also many where they try to talk to the program officer, but cannot get a hold of him or her. So it's not required. There are times when, if there's a project that I'm unsure of, if it's a fit, I didn't read any of those here. There's none that I saw that I reviewed that I am curious if it's a fit for NIH or not. They all seem to be very clearly appropriate for NIH to me, but sometimes there's things that we're not sure if it's a fit. In that case, we definitely want to identify an institute or center and find a program officer. More important than a topic, when you're talking about an NIH proposal, there are two things that you have the opportunity to do. The first is request a primary, secondary, or even tertiary institute or center. So you have the opportunity to say, I want this to go to NIDDK, or I want this to go to Heart, Lung, and Blood. And in addition, you can select the study section, which does not have anything to do with the institute or center. Study sections are organized by discipline. So there might be one on imaging or diagnostics or clinical decision support tools or pharmacological development, or they're organized by discipline. So you can request one institute and center, and you can request a study section, and they may not seem like they're related on paper, but they are. I could do an entire workshop on picking study sections and institutes and centers. There's a whole strategy behind it. But the majority of the time, you can leave that information blank, not request anything, let NIH do all the work, and come out just as good. Okay, contacting the program officer. So NIH, again, you don't have to, but they encourage contact with the program officer. It allows you to build a relationship, which is a really important part of the process. I started my career 20 years ago as a really traditional fundraiser. The #1 rule in fundraising is people give money to people. And that's what you're doing here. You're building a relationship with the program officer. They are not the primary decision maker on whether you get funded or not, but they can be a very good advocate for you if it's needed. So that's why you're going to try and build a relationship with them. Every solicitation is required to list a federal contact. And so if you look through that 220-page guide of topics for NIH, each topic has a program officer listed. Sometimes those people change since publication, and if they do, that person will always be very good about forwarding you on to the correct new program officer. Typically, what I recommend is that you first contact their primary preference is first contact via email. And I'll show you the sample email language I recommend on the next slide, but you send an email to request a 15-minute phone call. You attach a 1-page summary. I have a particular format I use for that, but you can also create your specific aims page or use something sort of like the case statement that Roland developed. Attach a 1-pager, one page for real. I mean, the rule applies to you. No more than 1 page, lots of white space. We're talking about a big overview here to see if they have any interest. If they're not responsive within 7 days, ping them again. But if you don't hear from them at all and they're holding back your project and you're getting frustrated, you can submit without, you are not getting anything from them other than hopefully some input. I will tell you about half the time you'll be disappointed. The input will simply be, yeah, this sounds good. Here's the guidelines. The other half of the time, you can get some really, really great input and feedback on your proposed specific aims. This is the format that I used for, for the 1-pager. Again, there's the problem, current solution, what are the shortcomings with the product on the market? What are you developing? A little bit about your team, the overall goal of your project to develop and commercialize, blah, blah, blah. And then what specifically you'd work on phase 1, what your phase 1 aims are, and those should be enumerated so a reviewer can quickly go and say, here's the 3 aims. And then just a short paragraph about what you'll see at the end of phase 1, plans for phase 2, and identification of the market. This is essentially a specific aims page, and that's what I recommend that you send to them. Here's the sample content that I recommend you use, pretty self-explanatory. The main goal here is that it's extremely brief, no more than 3 paragraphs. Do not put a giant abstract in your email to them. They will not read it. So again, you're just asking for a short call to discuss your project. And again, contact with the PO is not required unless you're unsure if your project's a fit. Sometimes that happens. Sometimes if they have a special solicitation and it's to that institute or center, which means it's not the omnibus, not the general, but a special solicitation, you might want to get some additional information before submitting. I would recommend you contact the PO if you're planning on submitting a direct to phase 2 or a fast track. Those are both applications that I would recommend you get feedback from them before you, they're huge undertakings and you want to be sure you're hitting the mark there. Also, if you have a budget, if you're going to submit a budget that's outside the allowable recommended limits at NIH is a loose term. So most of the time I don't even have people contact them for that. So, okay, that's it.
All right, I'll just say a couple of closing things then. In the Canvas are our emails. I also put emails in the chat, so we have little time for questions here since we're out of time, but feel free to peg us with the emails, and feel free to schedule open hours. The links will be there in Canvas. Read the assignments. We don't have time for me to review the assignments, but they are in Canvas. You have a set of another 5 assignments for this session. Try and get them done by Friday so that Kris and I have the weekend to look them over, but at least by Monday to make sure that you get comments from us.
I'm going to stay on here and answer these questions on the chat real quick since we didn't have time.
Okay, I answered a lot of the questions while you were talking. In fact, I don't see any outstanding questions in the chat right now.
Oh, okay, never mind.
All right, so Ellen, Sonia, Kathy, Sherry, anything else to add in closing?
One question I actually had was, there's a lot of great information in the chat. Can we, in addition to publishing the video, can we publish the chat discussion as well?
Yeah, we can capture the chat and include it when we send out the materials. That's fine.
All right, hearing nothing else then, I hope the session was helpful. Feel free to give us your feedback on what works and what doesn't, and feel free to get in touch. Make sure you do the assignments, use the tools, however best fits your company's need. They're tools for you more than they are methods for us to assess. Thank you, everybody. We'll see you next week.